Prescription Charges Coalition says it's worried that people may not pay for vital medications as the cost of living soars, and is calling for the government to review the situation. Ade Williams is a community pharmacist in Bedminster and friend of the show. He says he's very concerned about the situation. Morning, Ade.
Good morning, James.
So just paint a picture for me. How much worse is this situation now compared to recent years?
Thank you very much for having me on as well, James. I mean, most community pharmacists will be very used in England, and this is a particular English problem, where the patient stands in front of you and they've got a prescription to take, and they're short. In the past, it could be that they haven't got a card or they haven't got enough cash on them there. But what's happening in the last few weeks and months now is the patients will tell you actually that they just can't afford it. In the last few weeks, we've had patients coming in to pick up prescriptions for example, for their children, for antibiotics or for themselves. And, they're getting maybe paracetamol or Calpol. And they'll just say, well, I'll just get the kids' medication. We've got to go and do the shopping after this. And I just can't afford to pick that prescription up. And why this is worrying, and the research shows this, is that we have patients that have long-term problems, common problems, things like hypertension, asthma, will go without their medications there, or decide to ration it. They'll have for 6 months of the year, they will do. And even though there are schemes that help to reduce the cost of this, like a direct debit, for example, or a prepayment certificate, the issue is, one, you need to have the money to be able to do it. Secondly, many people live in trepidation of not being able to meet payment to the government. Maybe if you're a service provider, you could there. So they actually don't want to commit to monthly payments. And we know that this particularly impacts on those that we already have issues in terms of the care we provide to them, James. People in our societies that already feel very isolated, that we spend a lot of time, I've been on this show with you many times, encouraging them to come into the pharmacy. So when they come in and they find out that they're being charged this levy, which is not the pharmacy's cost, it's just that the NHS has burdened community pharmacy with the responsibility for this levy, they just then really disappear. And even when there are other things like flu vaccines or things that are free, nobody wants to stand in a community pharmacy counter and think, oh, I can't afford that, and walk away. It's dignity, it's fairness, but it's really, really something that we know now is, affects people's health and is helping to exacerbate health inequalities in our community.
Well, this is the concern, what the impact could be on people's health if they just don't pay for their prescription. And obviously, to be clear, there are lots of people who are exempt from paying prescription charges, over 60s, people on low incomes, that kind of stuff. And there is, isn't there? There's a really good, I think, tool on the NHS website where you can do an exemption checker to see if you are eligible for a prescription exemption. But you're saying, Ade, that even working age people who are just struggling with the rising cost of living, they're just going to end up not paying their prescriptions.
Yeah. They are, and we're seeing that because we know that the disproportionate impacts of the cost of living is on working age people, and where that is that for the first time for many people where they've had, let's say, disposable income and incidental episodes of ill health has just been something they've been able to factor in. Now they don't have those buffers, and actually what they're thinking is, I'm okay, do I really need this medication? And for us, in the past, we've always had ways of being able to help people when they're a bit short. We have people that sometimes would, give us gifts for treats, there, and we would use that there. But we are conscious now that, we look at people who are not collecting their prescriptions, for example, and we see, well, people are not collecting their inhalers, they're not collecting their blood pressure medications, there. And when they come in and you say, well, you've got about 3 months left behind, they'll go, well, actually, I just couldn't afford it, so I'll just take this one and maybe I'll come back again in 4. And those are the concerns, James.
So are you seriously, Ade, considering paying yourself or through the pharmacy's costs? You are considering paying some people's prescriptions?
We've and I don't want this to sound overly altruistic, James, but it's not unusual for us in the past to have helped people there, with prescription charges. It's the reality of the life. James, you come into healthcare not wanting to be the person that is charging a levy for people to access their medicines. And you know, in the past, you know, people might have been, you know, there may be a few pounds short on one item or not. It's not sustainable. It's never been, but we've always been able to do this. And I think for us as a team, you know, we've just really looked now and we're conscious that this is happening more and more, and it's happening to people who are finding themselves really quite, you know, in a very undignified place. You know, many people in the past maybe never even thought about the cost of a prescription charge at 9.35, and all of a sudden with 2 items, it's £20 that they're having to, almost £20 to pay out there. So we have been looking at this and we've been saving money aside to help people to do this, not because we're trying to set up some sort of a moral bar, but we just think, you know, we would rather it will break us to keep turning everybody away. At the same point, we know we can't help everyone. So what do we do? But it's building on what we've done in the past, but also for us, it's really identifying the fact that this needs fixing. And the fixing is really for us, for the government in England to line up with the rest of the UK. Fixing is for people to sign the petitions to say, well, actually, why are we doing this? It's only going to it only costs the NHS even more, where people don't take the medications that they need to manage these long-term conditions. But also for community pharmacy teams, you know, it breaks the trust of the NHS, where people come in and feel as though to access the care that we know is part of the core values and principles of the NHS, they need to be this exchange of money. And they sometimes think it's community pharmacy that's taking the money, but it's the NHS levy. So, James, yes, we have been, and I guess on the other side, they're thinking, like, does that mean everybody's going to pile in and try and come and get a free prescription from us? James, the truth is that most people don't want this. People are too dignified and they would rather walk away. And that's what breaks us, is that we see people walking away. Even when we give them the options, you know, they just don't want to, you know, take charity or even sometimes put themselves at risk. You know,
but it would cost so much though, Ade, wouldn't it, for the government? I mean, I absolutely understand what you're saying, and I've got no doubt that there are lots of people who are just walking away and not paying for their prescription, and I'm sure that is heartbreaking for you as a community pharmacist. But can we really afford to extend free prescriptions? I mean, we've got the nurses striking at the moment. They're asking for a pay rise. The government say we can't afford that. Can we afford free prescriptions for everyone?
And I think, James, what we are saying is that we should have a better way of collecting this levy, because it's a levy to try to fund the NHS. You know, that's what it is. And maybe central taxation, maybe the more, I think where we've got at the moment is that it's become a barrier. And we know it's a barrier there. And it's a barrier for the most vulnerable people, for the people on the lowest income who are very squeezed, for people in marginalized communities who don't trust the system. So even when they have access and rights to free prescriptions, they don't just want to tick a box because they're worried that they're going to get a fine, they're going to get summoned or something. So we know, the evidence tells us what's happening, and we're saying we can fix this. We can take away the fact that when you're feeling poorly, it's not when we're asking you to give cash to, you know, to exchange cash or bring out a card, but there's another way to collect the levy. That is what this is really about, James. We know that everybody the government is under a lot of financial pressure. We're all under a lot of pressure. But what we're saying is we need to fix this, because ultimately we're going to pay even more to correct the impact of this. That's the problem. If people are not picking up those prescriptions, they will, unfortunately, their health will deteriorate. We know it's causing a lot of mental stress as well for people, not just physical ailments that are not being controlled, but the mental impact of that physical as well as the point there. So that's what we're saying is, let's find a better system rather than this levy system that's really not the best.
Ade, thank you. Ade Williams, community pharmacist from Bedminster. Campaigners say some community pharmacists are considering paying for patients' prescriptions themselves because they're worried the rising cost of living is stopping people from picking up vital medication.